Welcome to Seagull Maritime's series on elementary first aid. In this video, you will look at the principles of first aid. Throughout, you will be asked to pause the video and reflect on what you have seen and heard. Ideally, you should watch this with at least 2 of your colleagues so that you can engage in group discussion.
Timely and effective first aid relieves pain, counteracts shock and prevents further injury, but it can also be the difference between life and death. Preserve life, prevent worsening, promote recovery. These are always your priorities. First aid is defined as the emergency treatment given to the ill or injured before more experienced medical personnel arrive. It is given to counteract shock, to relieve pain, and to prevent further injury or death. Certain conditions require immediate treatment if the patient is to survive. In cases of severe bleeding or asphyxiation, a few seconds delay might mean the difference between life and death. However, the treatment of most injuries or other medical emergencies may be safely postponed for a few minutes to locate a more skilled first aider or suitable medical equipment. From a new trainee to the master, all crew members should be prepared to administer first aid. You must have sufficient knowledge to be able to apply emergency measures and make conscious decisions on whether treatment can be safely delayed until a more capable person arrives.
Why is it important that every crew member is able to deliver effective first aid? Click the pause button and start your discussion.
If you are ever called upon to deliver first aid, it's important to know what you need to prioritize. You can do this by remembering the 3 Ps of effective first aid. Your first priority is always to preserve life. If a casualty is in immediate danger, it's a life over limb situation. Opening an airway or performing CPR is far more urgent than immobilizing a broken arm. When necessary, you must work to save their life. In some cases, this might mean moving a casualty with a spinal injury, even though it might cause more damage. You must also remember that preserving life includes your own, so you should never put yourself or others at risk. The second principle is to prevent worsening. Unless the casualty's life is at stake, this means you should not do anything that might make their injuries or the overall situation worse. Rushing into an enclosed space without checking the atmosphere inside is likely to add another casualty. Don't let this be you. Promoting recovery is the third principle. This means you should offer the correct treatment for whatever condition you find the person in. You can also promote recovery by arranging prompt emergency help. Simple first aid can significantly affect the long-term recovery of an injury. Quickly washing a burn under cold water will reduce the risk of long-term scarring and will encourage early healing.
Why is it important that first aiders assess a situation for danger before approaching a casualty? Click the pause button and start your discussion.
As a first aider, you have certain responsibilities when arriving at the scene of a medical emergency. The first thing to do is assess the situation for any dangers. If it's safe to approach the casualty, diagnose the injury. If there is more than one casualty, you must identify who is in the greatest need for medical attention. Is anyone not breathing? Is anyone bleeding or burnt? The following scenario involves a simulated blast on deck, where the first aider must decide the order of treatment for 5 casualties. In circumstances where there is more than one casualty, you should triage according to A, B, C, D, and E. The first thing to consider is the airway. Upon your arrival at the scene, be mindful of any quiet casualties, as they may have a blocked airway. This is always your first priority. To open an airway, use the head tilt chin lift technique. Place one hand on the forehead, 2 fingers on the point of the chin, and tilt the head back. If necessary, use your fingers to remove any visible obstructions from the patient's mouth and throat. After opening any closed airways, check the casualties for signs of normal breathing by using the look, listen, and feel technique for a maximum of 10 seconds. Lower your head over the casualty's face and look down at the chest to check for any rise and fall. Listen for any breathing sounds and bend down to see if you can feel any air on your cheek from the casualty's nose or mouth. If the casualty isn't breathing, attempt to restore circulation by using CPR, which we will look at in more detail later in the series. If the casualty is breathing, they can be placed in the recovery position while you move to other casualties. Your next priority is circulation, as casualties may go into shock and any major blood loss can be fatal. Next, treat any casualties with disabling injuries. These include injuries such as fractures and burns, which are not usually life-threatening, but require swift attention to prevent worsening. Finally, treat anyone else affected by the incident. This may include those who have sustained minor injuries and anyone else who may have witnessed the event. If you ever arrive at the scene of a medical emergency with more than one casualty, remember A, B, C, D, E to decide the order of treatment.
We have just seen the order of treatment required when triaging multiple casualties. Why is it important that casualties are treated in this order? Click the pause button and start your discussion.
As a first aider, you should stay with the casualty until you are relieved by more experienced personnel. Their condition can change very quickly, and they should not be left alone unless you have no other choice than to go for help.
Okay, I am on my way.
When the designated medical officer arrives, tell them exactly what you found, the extent of any injuries, and any treatment you have given. Be as clear as possible, and don't exaggerate or assume anything, as what you say could have an impact on any further treatment. Remember the 3 Ps: preserve life, prevent worsening, and promote recovery. Do this, and you might save someone's life.